Hi, I'm Ben, a third-year medical student at Imperial College, and this is SafeSight. By 2045, the global population living with diabetes is calculated to be over 700 million. As a result of their raised blood sugar, people suffer from something called diabetic retinopathy, where due to proliferation of new vasculature in the eye, they experience permanent vision loss. By 2045, over 240 million people will be suffering from this. The good news is that this is easily detectable with machine learning approaches, and 95% of vision loss can be prevented with low-cost, easily implemented treatments such as pan-retinal photocoagulation or even just lifestyle measures like blood sugar management. But the problem is people just don't know this is happening until it's too late. Therefore, the onus falls on screening. A large part of the current problem is that existing screening methods require specialist imaging and review, making them complex, expensive, and inaccessible to areas without either the staff or equipment to image the retina or the ophthalmologist to review the scans. To increase accessibility and keep up with this rapidly growing demand, I propose we need to enable people to image their own retina using affordable, reusable, return-shipped 20D condenser lenses and an app to guide them. This would then be uploaded to a centralized, automated screening service to analyze the images, removing the bottleneck of ophthalmologists, whom there's already a growing shortage of, even in the countries they are available. This reduces screening costs, lengthy wait times, and margin for human error, whilst allowing a far broader scope and development of a database to combat all forms of eye disease. So how this works is we'd use the rear camera for its better quality. The app then detects the phone make and model to preload camera settings for appropriate zoom and flash for the best image quality, and displaying instructions on the back, reversed, allows them to be read in a mirror, allowing us not only to guide the user, but also to properly position their pupil by guiding their focus for proper imaging. All of this compounds to require minimal input from the user and increase image standardization. These are then uploaded after initial quality screen, similar to uploading a passport photo, to a centralized screening system where multiple approaches such as IR have achieved sensitivity levels matching or exceeding human graders. It's important not to understate the global health impact available here. Not only are we able to massively reduce costs of existing screening programs, but also roll out to areas where it's otherwise unavailable or impossible. This increased uptake and earlier detection reduces disease burden along with health and social care costs. Translatability is one of the key pillars of this project, and I'll expand further on this. So what separates us from other initiatives? We're utilizing what is the most widespread imaging device in history, not relying on being able to sell new devices that ultimately end up creating more waste, not reducing it. Rather than attempting to secure scarce funding for new imaging equipment and professionals, this novel approach means a single aid worker or community member would be able to scan hundreds of people in a day using a secondary mode on the app, nothing more. The relative simplicity of this process is vital to its success, as for global rollout and impact, we need as few moving parts as possible. Finally, there's a multifactorial advantage that the translatability of this approach has on its economic feasibility, global health impact, and its unique opportunity for the biomedical community. So I've talked about targeting diabetic retinopathy, as this is the specific use case that I found proof of concept for. But as a process, this could be easily adapted to screen for over 50 other diseases, with the only necessary changes being centrally software-based, and previous scans could be re-screened as capabilities expand to include more diseases. On top of the individual suffering, this current inability to detect eye disease has cost the global economy over 4.8 trillion, leaving us plenty of room for impact, and makes me confident in the economic viability with low rollout costs and massive financial burden that people are eager to address. Furthermore, what makes the outreach side of this possible is our success in developed healthcare systems will be used in turn to fund and promote international outreach, so we're not reliant on being able to secure already heart-fought over charitable funding. The more data that's accrued in outreach creates a more valuable product in the high-spend healthcare market and the database created. These successes feed back into each other, and we are so forth able to help more people. This also gives us a unique opportunity to combat biomedical research inequality, a problem few are yet to address. As we would be able to image the retina of populations who've never had access to screening, and historically have been medically underrepresented in both research and care, who also suffer disproportionately from all forms of eye disease. A truly diverse set of imaging like this is essential to bridging that gap and reducing preventable blindness for everyone. The prize money would allow us to carry out vital small-scale user testing to establish our minimum viable product and expand into our beachhead market of London primary care practices through their respective CCGs by offering significant cost savings and improvement in outcomes. Thank you very much for listening. I hope you agree this is a truly necessary step of innovation in making the majority of avoidable blindness a thing of the past for everyone.